What's something that couples could consider other than IVF that works to get pregnant?
Everybody really wants to know what else is available, simple treatments, and they might wind up spending $5,000 or $10,000 on IUIs, which is a waste of money, and they'll usually go to the health food store and buy all kinds of dietary supplements, because if something costs $39.95 or $59.95, they figure, let's try it. But none of them really are effective, and some of them can actually be harmful because they might put estrogen or testosterone in them just to get some kind of an impact or an effect. So it's really a problem. Now, the best advice I can give, though, if you're young and you really don't want to go into IVF and you can't even afford IVF right now, is to avoid the advice that you're getting everywhere about timing intercourse. These ovulation kits are not very accurate, and very frequently you'll wind up having your intercourse after you've ovulated, and the egg is no good 8 hours after it's ovulated. You always want sperm in the reproductive tract of the female, and the sperm will last and be good for 2 or 3 days. So I tell people, don't try to time when you have sex. It does no good. We told you that many times.
Yes.
Just try to have a happy, healthy marital sex life, and that usually turns out to be 2 or 3 times a week on average, unless you're too busy in life. And at 2 or 3 times a week means there will always be viable sperm in the tract for whenever you ovulate. So I think that's the most important practical advice I can give, short of technical treatment, and that's what we did with Amy.
Yeah.
I said, you got a good ovary, a young ovary, and don't do any timing or ovulation timing or induction. Just have intercourse.
Yeah,
and have a happy
that's all we did.
life.
Yeah. I mean, I never, and I think that to me too, that just added like an additional stress. And I think that with everyone in general, we all know that stress affects the body.
Yeah, right.
Even when you're trying to get pregnant, you know. So I think that like a lot of times when you focus on like timing your ovulation, you're so focused on that like adds another element of stress, because you're not getting pregnant and you're like, I should do it right now, like you know.
And that stress, it can prevent you from ovulating because it affects your hypothalamus, the primitive area of your brain that controls the pituitary gland. So, I mean, the stress associated with trying to time your intercourse can actually prevent you from ovulating.
Right.